Ron is a recreation program staff at a city-run community center.
I'm the recreation programmer. I look after all of the adult and senior programs. It's like a physical recreation side and then a social recreation side.
He's worked at various settings, including independent nonprofits, and found stable employment at the city-run center. One day, Ron received a call from a doctor's office introducing Dana. Dana lives in a subsidized housing facility with mold problems. She has sought help from the Tenant Resource and Advisory Center, but dares not take it up with the housing provider. She felt unease and was referred to the community center for help.
We do have those participants, not all too often, but we do have referrals that do, for someone who's needing to exercise more or to have more movement or to work on their balance or whatever. We do have some doctors' referrals. It doesn't really affect the participant or our business per se, because we're a community center, and that's never really been a huge deterrent or anything for taking part in programs.
Dana wants better housing and something to take her mind off the frustrating situation. Ron wants to help, but is not sure where to start. Seniors programs at city-run community centers typically focus on social, recreational, and educational activities and not supportive services.
There's different seniors groups out there, so hopefully that they're willing to share where else they can find resources through those partners.
Ron had contacts from other organizations where he worked, including independent nonprofits. Dana lives further away from the nonprofit where Ron's contact works, but thankfully is able and willing to travel. Ron found time to introduce them and also got Dana connected with others at Seniors Coffee Hour. Dana got some help to explore her options and lodged a complaint. She also met a senior volunteer at Coffee Hour who had the same experience and helped her feel better about the situation. Dana drops into the mental wellness circle occasionally. Addressing mold growth in low-income housing environments protects the health of priority populations. Community centers rely on staff networks to build trust and address diverse needs. Besides improved housing, a more systematic approach to identify upstream needs is needed for older adults who may not advocate for themselves.
We get a lot of participants and members who are connected with local healthcare providers. We're very closely located and in partnership with Reach Community Health Center, so a lot of their membership crosses over with our membership.
Digital Social Prescribing Lite connects seniors who visit family clinics and pharmacies with relevant community activities. Seniors like Dana could find a link worker or a friendly advocate with whom they could solve non-medical problems together. Through a community of practice, Ron could meet other community staff and share best practices to help seniors feel at home. Had Dana not been able to travel, co-location of information referral and supportive services within community centers would help Dana access the services she needed.
As long as they feel connected to the site, the person, the people that are going, then that's a huge encouragement. You feel in control in this space because your needs are being met, your values and opinions are being heard. And again, working in the seniors department, they are very playful and joyful. So counterbalancing that too, where all feels very nice and lighthearted, I feel like this would get people through the door. But ensuring that you're actually adding a bit of substance to this as well, and tackling some of the harder things that come in association, especially in healthcare professions or in community professions. Like there's a lot of things that should be open to the table to discuss, even if they don't necessarily fall into these three categories.
Appropriate staffing allocation to support the local community of practice would alleviate the extra mile Ron and his colleagues had to go to meet diverse needs. Municipalities in urban centers would convene networks of health and community stakeholders to identify the most connected personnel for link work with provincial funding. Shared social prescribing platforms could inform the level of staffing responsive to needs. More connected and responsive city and community staff means non-medical needs will be met before they affect residents' health and well-being.
And I think that's a huge point in terms of partnership building, is really beneficial just to make sure that regardless of what organization or community center healthcare provider is offering, you're not starting from scratch, because you can connect to a person or a place or a center that did successfully find a way to offer that to their community members. And how can you do that? How can you teach me to do that here?
As well, recreation program staff will be better equipped to connect seniors with other services they need. With data from the social prescribing platform, neighborhood managers can monitor and share how city and community staff are contributing to place-based wellness, so they're sufficiently resourced. Link workers can procure additional services and staffing to address unmet needs. Mutual respect, intersectoral collaboration, and initiative from city-run community centers are key to nurturing better interconnections for aging in place. Pause today to listen and act on one need for a better tomorrow.